first recollection of receiving health care at a public health facility in my country, South Africa, was that it was a full-day event. My mom would usually pack in sandwiches and a flask of tea. She would be happily preparing this in the kitchen before dawn, obviously accustomed to the system, our system, and like a good mother, ensuring that we were happily satiated for the full long day for our visit to the primary healthcare clinic. My mom was also aptly prepared for the clinic day that would be spent being directed from one section of the clinic to the other before we appreciatively completed our mission for the day. My impression of the clinic then was that it was full, hot, stuffy, and the staff often looked tired. I questioned my healthcare system, meant to be tailored to the need of the patient, that presented myself and my mom with such an experience, when an appointment that was meant to be done much shorter took a full day, where the environment was actually not aligned to our needs. Perhaps I did not take into account that South Africa was evolving and undergoing significant changes at that time, which greatly impacted the context and its systems, and we perhaps were doing our best in exceptionally trying times. I did, however, question my healthcare system. Now, decades later, I work for the Department of Health in the HIV and TB program in the Western Cape Province in South Africa. My job entails public policy writing and the implementation of this policy within the community. Improved patient-centered care is the Western Cape Province vision for health care. As a public health professional, now deeply rooted in the health of the public, my questioning of the healthcare system has now extended to the role I play in this complex system. How can I effect the greatest change to have the most impact? I ultimately found this answer in healthcare policy writing, formulation, and its implementation to address the needs of the community. This is to be able to improve outcomes and to ensure that the patient experience and their journey in the primary healthcare clinic is satisfactory. An example of such a policy was the multi-drug resistant tuberculosis policy framework on decentralized and deinstitutionalized management in South Africa, which advocates for the decentralization of stable MDR-TB care. This was in response to the increased bed occupancy in TB hospitals. This policy decision, however, allowed the patient to have better access to care as they were closer to their homes and not inpatients for an extended time within the TB hospitals. I firmly believe that my country has the health of its people as a priority, and its health systems has evolved and strengthened over time. I feel inspired that the health system is progressively improving to address the needs of the patient. This is evident in the health system that is currently implementing a policy that advocates for the integration of healthcare services so that patients are able to come to the healthcare facility and be managed comprehensively. The curious girl in me now does not question my health system. However, I question my role and how I can contribute meaningfully. I believe and I have hope in my country and its healthcare system that continues to grow, strive, and improve for its people. Thank you.